Good Friday morning, everyone. It is October 29th. Welcome into the Morning Medical Update. So glad you are with us. Thanks for joining us on Facebook, YouTube, and Twitter. Today, we are celebrating Respiratory Therapist Week. They definitely need more than a week, that's for sure. Those who have stood at the front line and the bedside of those fighting COVID-19, you're going to meet two of them right here this morning. We're also going to get to your follow-up questions from this past week. But first, let's get to Dr. Hawkinson with our COVID numbers from overnight. Good morning to you.
Yeah. Hi, thank you. Yeah, our count of active infections has really stayed the same. 18 active infections, 7 in the ICU, and 4 of those patients on the ventilator. 2 of our patients are vaccinated out of that 18. One has age as a comorbidity, melanoma as well, so significant comorbidities as well. And then another patient is here positive, but also here for other reasons as well. We still have 27 in that recovery period, so a total of 45 right now.
All right, thank you for that update. Guess what I have? I got to brag on you just a little bit. Look what ended up on my desk.
Yeah.
Okay, so we're going to pull up this screen because speaking of numbers, you're looking at the Ingram's 25th Medical Edition cover page. 4 health system doctors represented, but one right here in our studio. Dr. Hawkinson, congratulations on this honor. Well deserved for sure. So I know you're kind of humble about it, but when you get this type of recognition, what does that mean to you?
Again, I think it just means that we are doing everything correctly. We are trying to do everything correctly here from the top down at this health system. From my colleagues in infectious disease, I mean, really everybody we've worked with, really since my career began, but of course, obviously now we've gotten a little bit more exposure with this pandemic, but certainly it's just people I go to work with every day. Again, my infectious disease colleagues, the hospitalist colleagues, really everybody here at the health system, the executives from all the way from Bob and Tammy all the way down. I've kind of been able to really see how this organization operates from the executive level down since the pandemic began, and I really understand now how and why it has grown to the levels that it has grown. And obviously you have been doing a lot of stories with a lot of other physicians and really understand the great people we have working here.
Well, thank you. Well deserved for sure.
And it's the respiratory therapists and the nurses. I mean, it's everybody. But I should say too that nobody has been on the front line have more exposure than our respiratory therapists and our nurses since the pandemic began.
Well, we are going to take our hats off to them for sure today, the best we can. But can I quote you? I read your article in there, and I'm going to quote you because I thought it was really nice. That you say that you always try to take time and pause and reflect on the blessings that you have. You're grateful for your friends and family, especially your children. But this is what stood out to me when you said, patients can't leave the hospital at night, but I get to go home.
Yeah.
So I think that really I think you've really said that many times, throughout this year and a half.
Yeah,
really stop and think.
I think it's being thankful that we are able to go home, that we can go see our friends and our family and be with them. Unfortunately, the patients have to be here, so we certainly try to do everything we can to make their quality of life better and ultimately get them out of the hospital and back home.
Yep, gratitude. It's the way of life. I appreciate it. Okay, so let's get to some reporter questions.
Hey, just a quick one from Cody Holyoke, Channel 9. Happy Friday.
Hi.
Hi. I'm talking to Nick, our weather guy, this morning, and looking at a really cold Halloween weekend, especially at night. And I was wondering, Doc Hawk, just your thoughts. I know that you were saying indoor gatherings probably aren't the best way to go here. Just suggestions for kids and for families this weekend.
I think we can still do trick-or-treating. I know the kids go out no matter really what the temperature is and what the weather is for the most part. They still like to go out and get that candy. So I think that's safe. If you can do things outdoors, if it's covered, and a lot of people have those portable heaters now, using that, just understand that risk of doing things outdoors or in larger ventilated areas, well-ventilated areas, is going to be a lot less risky as far as spreading the disease than those indoor gatherings. And I know it's difficult, especially if there's precipitation and if the temperatures are too cold, but really trying to stay out of those high-risk environments, and those are really the indoor gatherings.
All right, thank you.
Yeah.
Thanks so much. Other questions? All right, no questions. All right, so we're going to get to our community questions here in just a moment, but we want to turn to our guests. It is Respiratory Therapy Week, as I mentioned, and we want to introduce you to two of our very own. John Sorick, right here to my right, across from me is Jacques Barbera. Both have been on the front line of this pandemic, working tirelessly with COVID patients day in, day out. Jacques just came off of a shift, and thank goodness John had a day off today, but came in with us today, so we certainly appreciate that. It has been a rough 18 months for both of them, so today we're just going to take time to honor them and their colleagues and hear directly from them on what it has been like at the bedside of these very sick COVID patients. And they also have other patients to care for that don't have COVID, so we'll talk more about that. Just welcome to both of you. We appreciate you more than words. Dr. Hawkinson said it. You're just there every single day caring for those patients at the bedside. John, I'll start with you. To kind of take us through a timeline of, we sit here today, vaccinated, a year and a half out, but kind of go back in time and kind of take us through where we are now, kind of these highs and lows that you've experienced.
Wow, what a ride, huh? It's been a trying year and a half. We've had some amazing highs, seeing some real miracles. We've seen some amazing care that has pulled things out where you thought there was nothing there. And we've had a lot of lows where you see families disappear. You see lives that have come and gone too fast. And it's really hard to consume it all when you think of the whole last year and a half. You just can't get away from it. Kind of how we were talking about earlier. You just, before the job was you can, like Hawkinson was talking about, we can go home. But now it's still around. You see it on social media. You see it everywhere, and everybody's talking about it.
And people are still dying.
Yeah, and it's still happening.
So Jacques, tell me, help me understand, just compare when COVID and coronavirus, those words came into our life, what you thought it was going to be to what it really ended up being. Kind of describe that for us.
I think most people kind of took it for granted that it was going to be just flu-like symptoms and they can just go on with their daily lives. And, to most of the people that are alive right now, we haven't been through a pandemic at all. And to get what is actually going on now and still having people debate about it now, and we see it firsthand in the ICU every night, every day, and trying to relate that to friends and family members that it's very serious out there. And, it kind of gets frustrating when people don't take our word for what's happening out there.
Like screaming at the top of your lungs for the last year and a half, right?
Yes,
Absolutely.
What has been some of your roughest times? I mean, take us to those bedsides, those conversations with families in the hallways. What has it been like?
It's been more, I would say, the two things that I hear the most are regret and I wish. The regret is I wish I would have taken this seriously. I wish I would have got the vaccine. I regret not doing these things ahead of time. And now we can only deal with what's at hand and deal with, while they're there in ICU and, try to hold their hand as much as possible along with the family members about, I'm sorry this has happened. And we don't have a timetable for anything either. We don't know when it's going to be over with. We don't know if you're going to get better. We don't know if you're going to come off the ventilator. We just don't know.
Constant state of limbo.
Constant state.
Yeah, John, what has that been like, though? Because you've really had to step, not only just sick patients, but during a pandemic, and here you are up there on those ICU units. And what has it been like, though, to step in and be that family member, like in that moment, where and just back to back to back to back?
There's, we just had a real big triumph. This last month, we had somebody go home who really touched our hearts upstairs, and to be able to watch somebody like that come out of it, and to see the first time that they get to see their children say hi and face for the first time, when isolation restrictions are pulled down, when this patient's no longer active, it makes it worth it. You have to trial through the darkness in order to get to the victories, and to make those victories so sweet and so worth it. It's amazing. It just makes it a lot worth it.
You answered my question, and I was getting excited to get to that place. Well, what have been some of the wins besides the vaccine getting here? Jacques, what has been a win like what John just described?
I described a particular night that we had in ICU where we had a patient that wasn't doing so well, and we ended up having to bag this patient for 2 to 3 hours until they could see if they were going to be a presentable candidate to go on ECMO.
What does that all mean when you said that?
Extracorporeal membrane oxygenation.
Okay.
Basically, they can bypass a lot of things to get for their lungs.
Got it.
And they ended up being our first COVID patient that actually made it through ECMO and lived. And so that right there was just like, we won a bout with COVID this time. And so it was a big deal.
What does that mean to bag them? Are you just putting a bag over them?
No, just we actually have to use a manual bag the patient and give them oxygen. Yeah. And because the ventilator wasn't providing enough ventilation and oxygenation for this patient to survive.
So for 2 hours, you were manually keeping that person alive?
Me and several of the nurses on 61. We
just
were doing
taking
that.
turns.
Just taking turns.
Breathing for them.
Breathing for them, yes.
Manually.
Yes.
Wow. So I want to ask a couple of things. Well, first of all, something good that did happen over this time. This is, I think, one of the last times I saw you. Is you got a chance during all of this. Do you remember a little thing called Super Bowl in Tampa? We didn't win.
Yeah. But there's part of me that tries to forget it, but there's part of me that really loves it.
We're never going to let you forget it. There you are in Tampa.
Oh, there you go.
And I remember, I was so excited for the very select few that got chosen. Everyone up there just deserved to go. And I know that was really tough. But I remember every time I would talk to any of you about this experience, it was, you felt this heavy weight to represent all of the people, all of your colleagues. What was that like? Just talk about that camaraderie that you all have felt and how you've leaned on each other through this whole year and a half.
It's a family, it's a camaraderie, and I've never served, but I've used it in the past where it's a time of war where it's like a foxhole mentality, where you just get in and you have to rely on the person next to you and you have to trust them. And when you get into those isolation rooms, it's you and that person in there. You can't have a lot of people coming and going. So you are wearing multiple hats, and you have to trust the person in there next to you and say, we're going to do this together, and I'm on your side.
Did it feel different than any other time you've worked with a team, a medical team? This time was just different going through this pandemic.
It was different. It was more, it was always team oriented, but I felt almost like an analogy where football or basketball, it's just, you play in all conditions.
And you used to play basketball.
A while back.
Did you play a little KU basketball?
A while back.
Not that long. Okay, so you know what it's like to work with a good team.
Yeah, I mean, it was like that. And we just know each other so well now that we have that chemistry. And it didn't matter, from all the different ICU units that I worked at and all the nurses, all the respiratory therapists, we worked as a team. Yeah. And nobody knew we signed up for a pandemic when we signed up for it to be medical. We just did it. And, people ask us, how do you do it? And I'm like, we just do it. Yeah. That is just, that's what we do.
Well, and when you signed up for this, I mean, and I think, and I want you to tell us a little bit about respiratory therapists and what they actually do in a normal state of being. But I mean, when you think about your respiratory therapist, we have a respiratory virus now. I mean, you are called to duty for sure. Tell people what your job is to help people get better. Because I think when we think of therapists, we think of physical therapy. Now we have respiratory therapy, but you are like the last line.
Yeah.
And you've been that with COVID.
Yeah, and just kind of how you're thinking with therapy, with physical therapy, occupational therapy, well, that's exactly what we do is we focus on the lungs where we need to flip the patient, move them into what we call a prone position, where they're now on their stomach for 16 hours, and then we flip them back over and they're on their back for 8 hours. And we might do that for a week and a half, 2 weeks, just depends on how well that patient's showing.
This is you proning.
Yeah, this is, and it's all hands on deck. And you have chest tubes, you have a ET tube, which is the breathing tube, which is their lifeline.
This is video that we would show often because we really wanted, and it was rough to watch because when you watch, it's a very brutal scene when you're watching somebody be prone. It is not pleasant, and it was. But we decided we wanted to share it because we thought maybe this will keep people with masks on and social distance
Yeah.
in the time before the vaccine. Maybe showing it keeps people vaccinated. You don't want that to be you. You don't want that to be your
Right,
loved one.
right.
What's that like when you're in those rooms, Jacques?
It gets back to more the teamwork again, because we've been doing it for so long that we know how to do it efficiently and well by now. And for the patients themselves, it gets to be sometimes, difficult, because we have to keep on flipping them back and forth and making sure that they're okay while we do this also. So it's done with care, but also at the same time we know that this is the only chance a lot of times for survival for the patients.
Well, and you're trying to protect the dignity of these patients
Yeah.
and for their families and caring for them like they're your own family
Absolutely.
member, right?
Absolutely, 100%.
I do not like to see grown men cry unless it's for a really, really good reason. And I know, John, you have gotten emotional when we have talked about
Oh,
this.
yeah.
But have there been moments where either of you, both of you, in your private moments, or have had to escape down a hallway and just take a moment? Jacques, tell me what that's been like.
I actually talked to one of the pastors that came through on the floor just randomly one time, and we talked, and I vented, and it was very nice to be able to do that, because I haven't been able to do that this whole period. Because what we experience in the hospital, nobody understands outside the hospital.
Yeah.
Even if you just explain to them, friends, family members, or whatever. I've been doing this since 1998, and I've never seen this amount of death in anything I've done.
Well, I think when I've talked to other folks who have worked on these front lines, that they say that's the biggest struggle for them, is that they're in the business of saving lives.
Yeah.
And they're so used to good outcomes because they
Yeah.
come in to save the day. And someday you just have to look at each other and go, there's nothing more we can do.
Yeah.
And doing that day after day, sometimes 3 or 4 times a day.
What gives me peace of mind, I'm sure Jacques the same way, is I go home knowing that I did the best I could. I gave you everything I could while we were here, and I've poured out to you while we were at bedside. I have to give it to you. I might be tired, but this is why you're here. This is what I signed up for. This is what I have to do. I have an amazing support system at home. My mom was a ICU nurse for 40 plus years. Actually retired right before this pandemic happened. So her and I can vent at home, and my children, like we've talked about in the past, and my great wife. So I absolutely am lucky to have that support.
Well, we talk about patient stories on here. We always say it's so crucial to patients to have a support system for their survival and getting back to life. And we don't realize how much it's crucial for you
Oh
all.
man.
It trickles down. Tell me about it.
We lean on each other for sure. We definitely lean on each other for, it could be humor
Yes.
or anything, just anything to kind of break away from that monotony that's just every day. Same, and then we get updates to how to do something different. From the day one from COVID till today, we do things a lot different than we did. So it's after a while it starts wearing on you. And if you have support, like John has support, but if you don't have that support, we still lean on each other.
Right.
For
You're getting
support.
it, right?
We
Yeah.
still get it from our managers. We still get it from our coworkers. And it it's been great that we've had that.
Yeah.
What are you seeing now? Well, what are you seeing now? We talked about some of these, we talked about these third wave. Jacques, you were mentioning it. Is there a fourth one coming? You never know. You thought it was one, then it's 2, 3. And, what is it going to end? Where are you at now? What are you seeing up there?
Right now, I think we see numbers declining a bit right now, as far as all of our ICUs are going right now. We still do see a lot coming from rural areas. Is that the majority of people that we've seen coming from, like Western Kansas or, stuff like, just a lot of rural areas that we're seeing right now.
John, what can you add to that? What are you seeing?
Our primary ICU, our primary COVID ICU is still primary COVID ICU. So it's funny to go from, not funny, I guess, but to go from where we were in flux and say, now we only have one ICU of COVID, whereas a year and a half ago, this wasn't even a thing.
Right.
We've always had a surgical ICU or a neuro ICU or a pediatric ICU because, those are always things that we know of. And to think that our culture in this hospital has switched where we might always have a COVID ICU.
Right.
That might always be a thing now.
A new time, a new time and place in your career and your daily life up there.
So with workforce, how it is out there, these hospitals that have beds, they aren't staffed, so we're getting all of that as well. So we are staying full at all times. We might not be full of COVID, but we are filling with everything else of what people get sick from.
There was life before COVID. There'll be life after COVID. Yeah. So we're going to get to community questions here in just a second. But just last question, though, before we do that. We have a vaccine. And I know, let's just get this out of the way, that you don't waver from any type of patient care you give anyone. I know that. We all know that. We talk about that all the time. But is it frustrating that we're still on the vaccination conversation? I guess that's an understatement.
Yeah.
Okay.
Yeah, the patient load that's coming in that's not vaccinated, and everybody's allowed to make your choice. You are absolutely free will. You're allowed to make your choice. But we don't have an ICU full of vaccination injuries. We don't even have a floor unit full of vaccination injuries. We have units full of COVID.
Unvaccinated COVID patients.
Unvaccinated COVID patients. And that's the hardest part, is you're allowed your opinion, and I'm sorry that the world might feel against you right now with how this anti-vax and where we're at, but that's the story you're listening to, and that's what you want to be, and we're here to help expand your mind and thought process, and we can talk about it.
But that's why we bring you on. I can't tell these folks or the community about proning and telling family members that their loved one is going to die. I don't do that. You do that.
Yeah,
and
what
so
it
when
smells
I bring,
like, looks like.
Right.
Yeah,
so when you come on,
yeah.
you get to tell everyone firsthand, it's happening, it's real, it's there. Jacques, just what would your message be to people about, we're not past the finish line, as we say. It feels like it, we want to be there, but we're not. But how do we get there?
Get vaccinated.
Yeah.
I mean, just 100% get vaccinated. I understand, like John said, I 100% understand everybody's reasonings not to get vaccinated. But if you just look at numbers, just our numbers alone, that the people that are, majority of them that are on the ventilators are not vaccinated. And sure, we do have a few, which nothing's ever 100%. But these numbers show that you get vaccinated and it tends to work in your favor.
Well said. All right, we're going to bring Dr. Hawkinson back into the conversation because there were some questions that we didn't get answered earlier this week. So let's get to those. Are the higher case counts in the UK and parts of Europe a preview of what we can expect? Do we look at them to kind of see what's coming down the road for us?
You know, we do and we don't. Again, some areas outside of the United States have higher vaccination rates than we do. We know that some of them now are getting some of their restrictions and their lockdowns. So I think, though, just as in the United States, where we have to really look at infection dynamics within that particular community, early on in the summer, it was that Southwest Missouri area compared to other areas in the United States. Now it's some other areas compared to where we're at. So I think you have to really look at those infection dynamics within that country. Also look at overall the cultural experience there, and what is their what do they normally see as their normal culture. I had a friend who just returned from Denmark, I believe, and their culture is very different. But most of the people there are vaccinated. Most of the eligible people are vaccinated. We just heard our respiratory therapist talk about it's people's personal decision, and so some people are not getting vaccinated. We certainly don't have the optimal vaccination rates for those people that are eligible, and it is your individual decision, but that individual decision does affect other people if you are able to spread it to others. If you are that unlucky few that also do die and leave orphans or leave other people in your family. So I think there are just a lot of different infection dynamics going on in any particular country, in any particular geographic region. We do take some information from those other areas, but it is also taken together with the totality of everything else, all the other data that we're able to identify and analyze as well.
I have a reporter question. Nathan at 41 wants to know, Dr. Hawkinson, if you have any reaction to the stance that the Johnson County Sheriff took that deputies will not be required to be vaccinated. Just your thoughts about that? I mean, I know we like to stay in our lane.
Yeah, but, medically, I was going to say, just medically, again, We know what can help prevent illness. We know that our first responders, our police officers, our firefighters, our EMTs are some of those that are at their highest risk. And it's even worse when they do get the illness. And even if they recover, they still have to be out of work for 10 days. You know, certainly we know that vaccination, especially early in the time period after full vaccination, you have actually a reduced rate of getting infected overall. So, but I think we would like to keep our workforce, our first responders, our police officers, firefighters, our EMTs, everybody to be able to continue to work. And I think the way doing that is by, you know, vaccination, keeping everybody healthy so that they don't have to be bagged for 2 hours or go on ECMO. You know, again, it is a small percentage, but anytime you get this infection, you are rolling that dice of having those significant complications. So certainly medically, again, we would continue to endorse that vaccination message.
Next follow-up question is, I'm starting to hear COVID referred to as an epidemic. Have we evolved from the pandemic? Does COVID now become just like the flu, something we just learned to manage?
Yeah, I think it's probably just kind of interchangeable right now. We know that the virus is here. We know it's in just about every country. We know it's continuing to be a problem in some countries more than others. But I think, yes, overall, we will have to just learn to live with it and manage it. But the best way that we will be able to do that is through vaccination immunity and doing that to help reduce, again, not so much the cases. The vaccination was never meant to stop cases. Now, in some instances, especially soon after full vaccination, we know that your risk of just infection is decreased. But this vaccination was meant to stop hospitalizations and death and severe disease, going on the ventilator, going on ECMO. And we know that these vaccinations do it greatly. So it's not so much the cases. We will probably continue to see cases. What we really hope for is that we aren't having to see you come into the hospital or having you come into the ICU. So we will have to learn to manage it, at least for the foreseeable future. Ultimately, would we hope and think that maybe it gets to be like one of our other common cough and cold coronaviruses? Yes, but that remains to be seen, and I think that's still some years out. So right now, yes, we have to learn how to live with it, manage it. We know this is a new normal, and how we're going to best go about doing that, and that is by vaccination to increase your chance of staying out of the hospital and staying off the ventilator.
I would imagine both of you look forward to the day when this is just like a flu.
Oh, man.
Yeah.
Absolutely.
Yes, 100%.
You know, and Dr. Hawkinson makes a phenomenal point. If you get the vaccine, you can still get coronavirus. That's probably something that probably Jock's heard a lot as well, is where you can still get it, but you didn't get hospitalized from it. You didn't have severe symptoms from it. You lived. You know, that's...
What kind of conversations are you happy to have socially? Because I would imagine in circles, social circles out and about, John laughs. I know he's heard it for a long time. What is it like, though, for you to have to be able to... Because you have a responsibility to educate and bring people off the fence, but it's frustrating. So what are those like?
I try to explain to them just the normal flu. And I said, you don't get tested for the regular flu, do you? They're like, well, no, unless you get symptoms. I'm like, correct. How would you know you would have the flu? And said, you come up with symptoms then. I was like, it's the same thing. I said, look at it that way. Like, this is what you're getting. You get the flu shot every year, or you don't get the flu shot. But if you get sick, like, oh, I had the flu, then you get treatment for it.
And
so
you don't die.
And you don't die. All right. And I said, it's the same thing. You could be a carrier and you don't know it. And I said, this is just a little bit more deadly.
And then you find out and it's too late.
And it's too late.
Can you guys pull up the proning video? And I want to ask John this question. You guys have that proning video. Do you ever do that to somebody who has the flu?
No.
Okay.
Well, severe ARDS,
flu.
yeah.
What is it?
Acute respiratory distress syndrome, ARDS.
Okay.
And it was something that we did maybe once a year before COVID. Now this is a twice a shift, 3 times a shift thing.
At the worst, at the height of this?
Oh, at the height, we were doing it every room.
Really?
Yeah. At the height, it was, I think, probably 7 or 8 people at one time prone.
Oh, yeah.
Kidding.
Oh, yeah.
In one unit, yeah.
Wow.
And what makes it even like, okay, did it recover, like COVID recovered?
Oh, yeah.
But your lungs are not good still. They are stiff. And I don't know if just going
the
to
fibrosis, the scar tissue
scar
that the
tissue.
body's incurred from the virus being in there is irreversible.
Well, that's my next question, and it's from Gary, one of our viewers this morning, regarding long haulers. Have you seen this, Dr. Hawkinson, with anyone who's been vaccinated? Are we seeing long haul symptoms with vaccinated people? And anybody have anything to add on that?
Long haul, again, we hoped that the vaccination would reduce your risk of long haul syndrome or long COVID. We do have good data and good evidence that vaccination does reduce your risk of getting long haul and long COVID. So I think that, and that was I think that was a study out of the Lancet, peer reviewed. So we do have good evidence that vaccination does reduce your risk of getting long COVID. We also hope that is true for the children as well. And of course, we've heard those anecdotes of those people that have gotten 1 or 2 vaccines after having been dealing with long COVID, and some of their symptoms have resolved as well.
Isaac has a question, Dr. Hawkinson. I've noticed that the active infection numbers are remaining steady while the recovery numbers appear to be on the decline. Does that mean there have been more discharges than admissions in recent weeks?
Yeah, again, some of our day-to-day numbers will be the same, but we have to take into account that does include discharges, new admissions, transfers in, and so, that would be one component as well, as we are getting those people who are still remaining in the hospital after their 10 days from when their symptoms came on. If they get in that recovery period, it just takes some time for them to get out because they still may be on high levels of oxygen even after they are feeling better and out of that recovery period. A lot of people still do go home on oxygen, some low levels of oxygen as well. But that is one of the components, yes. Some of those people in that recovery period are ultimately getting discharged.
Okay, Brian has another question for you about a study. So if you haven't gotten to that study yet today, let me know. But what do you think about the study of veterans, which showed those who took J&J, their immunity dropped to just 3% effectiveness after 6 months? Based on this data, should a person decline the J&J booster and then get an mRNA booster instead?
Yeah, I don't know if that's the Morbidity Mortality Weekly Report. That was a big, a large paper a couple weeks ago, if this is the one that he's talking about, that did show that those people, especially from the veterans who were over 75, did have a significant waning of immunity, which they identified by having increased hospitalization rates, and that was one of the data sets and the articles that was the impetus of recommending those boosters, especially for those people over 65. I think a lot of people are recommending the mRNA vaccines if you did get that first dose of Johnson & Johnson. Really, anyone is going to be okay. I think it boils down to what do you think, do you have other reasons why you don't want Johnson & Johnson again? It is certainly still reasonable to get that second dose of Johnson & Johnson. But also, as we've heard, that mixing and matching is allowable. And so if you think you want to get that mRNA vaccine, that second dose for your booster, that's reasonable too. And I would certainly support that.
All right, it's cold out. Isaac wants to know, will it ever be safe to go to the gym again, especially if you're vaccinated? Just especially now that it's getting colder again. And I know when it gets cold, that's kind of all there is to go do sometimes. But what are your thoughts?
Yeah, I know, just individually. So certainly I still go to the gym. I do wear my mask. There was a time point when I did take my mask off early on prior to this surge. I think if I see the overall case numbers are going to be lower, the overall rolling 7-day average case numbers, and we know that is going down in the Kansas City metro area, it's certainly safe. Just understand what is your risk tolerability, and understand that those situations like classes are certainly higher risk than some of the other things you may be doing. I know it is difficult with a mask on to do some exercises, especially cardio, things like that. So just understand the risk tolerability, and I think especially if you're vaccinated, that it is certainly more safe to go. If you can use a mask and you're not doing anything like cardio or anything like that, it should be safe as well. But we also know that overall health and activity is part of that overall health. So we need to just try to stay healthy as much as possible and do all those things that you can. But I do think that going to the gym, especially if you're wearing a mask in those situations, should be something that you can do.
All right. And exercise is healthy.
Yeah.
Stay healthy. All right. So Heather has a question. And Heather has been on our show before and is a long hauler. News has said that long haulers have seen improvements from taking antidepressants. So, Dr. Hawkinson, I want to ask you about that in a second. But I want to ask our guests, just why do you think it's still, why is it so hard for people to realize that long haulers is not in people's heads? How can us long haulers get other people to let other people know that it's a real thing? So if you're lucky enough to get out of the ICU, then you're unlucky enough to be part of our long hauler clinic where people are still struggling after an entire year. That must have to be part of your conversations, whether inside the hospital or even out socially, is that if you get past the COVID, we still could have a host of issues going on.
Yeah.
And it's a real thing.
Yes. I like to refer to it as, I'm sure Dr. Hawkinson would agree, is that we're going to see this long haulers kind of go into the category of 9/11 lung, where we had that post 9/11 respiratory fibrosis, huge hit from everything that they had inhaled during that terrorist attack.
20 years ago.
Yeah.
So.
And these people are coming out and they're all getting cancer and they're passing away. Now, I'm not saying that the COVID's going to lead you to cancer like that asbestos exposure and whatnot from the debris of 9/11, but this is something that we are going to deal with.
It's a good parallel because we're talking about, oh my gosh, someone's had long haulers for an entire year. That seems like a long time. You might be lucky if you have it a year.
Yeah.
Is that what you're
We've
thinking,
had
Jock? What
perfect-
are your thoughts?
Yeah, it's unprecedented, like what we're doing right now. So we don't know how long anything will last, or it will last, and that's part of the frustration when you talk to patients and family members, is that we don't know for sure. We can just try to give them the best answers that we can.
Don't gamble it.
And don't gamble. And we have the smartest people in the world working on this, but they've only been able to work on it for a short amount of time. And so that's kind of the
only know what we
frustration.
know.
We only know what we know right now.
Right. Okay, we're going to be talking about kids because we know they're going to be getting their vaccines. You said, how old are your children? You said?
4 and 7.
All right, so they're ready. Are you going to do the vaccine?
Yes.
Oh, your 7-year-old?
Yeah, my son will be, absolutely.
Is he ready? You've
He
prepped
is.
him?
He knows about it. We've talked. Obviously it's in our house.
Yeah, it's just
The
part
discussion is around.
It's
He's
part
like-
of the deal, right?
He even saw it on the news. Like, oh, I'm in that number.
Yeah.
Like,
Who knew they'd be excited about
Yes,
getting
you
their
are.
shot? So this viewer said, my 7-year-old granddaughter had a mild COVID case. Do you think with schools being open that many kids have just already had COVID? We didn't know about it. So if they have enough immunity, why would we bother get them vaccinated?
Yeah, I thought I saw an article that showed that there was a higher estimate of pediatrics who actually had the disease than the cases that were identified. But again, this is not isolated to just pediatrics. We know that overall around the world, the estimates are higher than the actual cases that were diagnosed. So I think that is something reasonable to surmise. Why would we get vaccination after infection? That's a good question. It still is recommended by the CDC to get vaccinated, even if you've had the infection. And again, what we do have evidence of from basic benchtop and basic science research is that those people who get vaccinated after infection develop, number one, higher levels of antibodies, but also have a better development of antibodies to other variants that they were not infected with. And this includes variants that we know about, but also we believe that will include variants that we haven't yet seen. So vaccination offers that improvement in your antibody and your T-cell response, your overall immune response. That is why vaccination right now continues to be recommended even after infection. And I think I would like to go back to that last question where, wasn't it about antidepressants?
Correct, yes.
So we know that the long COVID, that syndrome, those constellation of symptoms are multifactorial, meaning many different things are contributing to those symptoms. And I think it also depends exactly what your symptoms are. Could antidepressants work? I think that could sometimes be a component of some of the treatment modalities that you can use, but I don't think that will be the only thing, because what we do know and what we do believe, especially if we're looking at the lungs, for example, people have shortness of breath or cough still, just what we've heard about the scarring. So we know there are physical changes there. We also do believe there are physical changes probably within the brain. We know a lot of people have brain fog and headaches still. We don't know exactly what those are. Those are things such as the immune function or that inflammatory stage that was going on during the active infection. So certainly antidepressants could be part of a multimodal treatment, but it is not going to be the whole thing. We know that there are probably physical changes in the brain that have to be more dealing with that inflammatory situation that's going on during that initial acute COVID infection. So it's just one more component, but it is certainly not the only component. There are many other things in that treatment modality, and depending on if you go to see somebody such as a neurologist for the headache and brain fog, kind of see what they do. But we are still learning what to do and how optimally to treat all of those long COVID symptoms.
Okay, just a few more questions. Catherine wants to know, Dr. Hawkinson, not sure if you know this, we need Mario Castro for this one, but saw an article about a stage 1 trial for a nasal spray drop vaccine. In the article, it said that most of the research is being done in Kansas. Does that mean it's being done here at our place?
Yeah, I'd have to take a look at that. We know that Dr. Castro was working on an inhaled treatment or early treatment. As far as vaccine, I've seen just a little bit about an inhaled vaccine. Don't know exactly where these centers are that they're using it. We could certainly talk with Dr. Castro about that. But I think it's good. I think it's one more thing that we can use to help prevent the infection, especially if there are continue to be those vaccine hesitant people for one reason or another don't want the shot. It's going to be one more thing, one more item that they can choose from to, again, hopefully get vaccinated.
A couple more follow-up questions. When are you and Dr. Stites going to get your booster? People want to know.
Yeah, I don't know. I'd have to talk with Dr. Stites about that. And,
Okay.
we could have gotten it when we got the influenza vaccine.
Well, that was
Got
my
about
next
the
question. Someone read that a Moderna flu COVID combo is in the works. Is that true?
I think they are working on that. I think that would be great. If we could really, we know the efficacy of this mRNA vaccine. We know that the vaccine efficacy for influenza can vary from year to year depending on the strains that are going around and predominating at the time. But we also know that those people that did get influenza vaccine, even in low vaccine efficacy years, still have reduced rates of hospitalization, missed days of work, and overall illness. So even if it's a bad year for the match of the vaccine to the virus strain, it's very important to continue to get that influenza vaccine on a yearly basis.
Okay, we're going to get to final thoughts because Jacques needs to get to bed.
Yeah.
What time did you get in last night?
I got here 7 o'clock last night.
Dear Lord. Okay, all right. Let's get this man to sleep. And then let's let you have your well-deserved day off, I'm sure, right? So, Jacques, I had the guys trying to find an old picture of you playing basketball, and Google couldn't even find it. Does that
Nope.
does that
He
mean
took
it
them
was
all down.
Was it that long ago?
Long story short.
Tell me.
88?
Yeah, it was played JV. Well, we had a JV team at that time. And we had a JV team at that time. We had a bunch of people kicked off the varsity team, which is the main team, which sounds like junior high. But, yeah, that's what had happened. We got a bunch of people kicked off that team. Coach Brown brought up some guys from the football team, and then a few of us got to transition and suit up and travel with the normal team. So we did that for the rest of the year. But come NCAA tournament time, we couldn't travel with anybody, so we just kind of just sat and watched everything, including was like half the band couldn't go, both mascots couldn't go because NCAA's regulations against that. So we sat back and watched everything, celebrated with everybody, and then later on, like 10 or 12 years later, I actually got a ring out.
Is that
of it.
the ring? Hold that ring up. I'm sorry, you got to hold that bad boy up. We got to see it.
So it's not like I'm not bragging or anything like
No,
that.
I'm bragging on you.
I was lucky.
Well, and I appreciate you saying that. I know you're.
I was blessed, fortunate, lucky
just to be a part of that moment.
Right, and I said a long time ago. So, and most of my time I was at Independence Junior College and then Pittsburgh State University.
Fantastic. Good shout outs to all those folks. Well, thank you for sharing. So, that's kind of a big darn deal, as we say. But you know what you're doing right now is even a bigger deal. Yes. How does this rank as far as just what you're able to contribute and do for folks and get them back back to life?
It makes it kind of follow in the footsteps of my grandfather. My grandfather was a physician in Independence, Kansas, and so I was always around him, especially being at that time I could go anywhere with him. So I was in ER with him. I was on deliveries with him.
That was a fun take your kid to work day.
Yeah, like even like the morgue, I was there with him in small town. So I got to do a lot of things with him that I wouldn't have got to do today.
It is in the blood
with HIPAA and everything.
Right,
so there's
right.
no way that would happen. So I knew from an early age that I wanted to be some medical in some capacity. I just didn't know until a little bit later. Oh, and the military got me into it, basically.
Yeah, and thank you for your service, by the way. We'll be celebrating you next week for Veterans Day. So just what's your final thought? As we all head into the weekend, we just want to hear from you, what you want us to know. How do we stay safe? How do we get past that finish line?
I think we just follow the advice of our professional healthcare professionals. Just don't get your news from social media. Stay away from the TV. Listen to your healthcare professionals. They know. They're smart for a reason. Listen to everybody, and they're going to try to give you the most unbiased, because everybody thinks that we're so biased with everything. And no, we're just trying to tell you what we see daily
And what you know.
and what we know. And I can say that. John can say that. Our good doctor here can say that. It's like, this is what we're trying. This is why we're here right now. This is why I'm not sleeping right now, because I want to get this information out there as much as possible.
Thank you for sitting at the table with us today.
No problem.
Appreciate you. John Slorick, final message.
Be courteous. Be nice to one another. And just like Jacques says, this might be new to you, and this last year vaccines might be in the forefront, and it's a new thought process to you, but these vaccines are on the shoulders of giants, of people who have worked through decades of research beforehand. And there's people out there that they've dedicated their lives to this, 50, 60 years to vaccines, and they show some respect. I'm not going to go to an electrician and tell him how he should be doing his job and the right wire gauge and wherever. That's not me. I hired a professional. You come to us. We're here to help you.
Well said. Thank you, friend. Appreciate you. Dr. Hawkinson, send us into the weekend, please.
I mean, I would like to just kind of piggyback on that. He said it best, These vaccines were an overnight success that took 30 years to get to. They're safe. Show some courtesy. Be compassionate for your fellow Kansas City and your fellow American. It is your individual risk getting the infection, but that also does play in and can affect other people, because we know that this virus can spread so easily between people. So I think it's just really continue to have compassion for your fellow Kansas Citian, your community, your country, and doing that. And one of those ways that you can show that is by getting vaccinated. Help reduce the spread of the disease, particularly to those people that are higher risk of having that severe illness that would end up here in the hospital as well.
Doc Hawk, thanks so much. And if you need some reading material this weekend, pick up the latest Ingrams, because I think you made like 3 or 4 pages in here. You're like on the opening cover page. Look at you. Wow, they're getting a lot of mileage out of your page.
I paid them a lot.
Yeah, okay.
I did. I made a lot.
No shame in it. Just admit it. That's all right. Congratulations on that honor. We appreciate you. Well, thank you all for being with us today and all week. Coming up Monday, the psychology behind whether or not to get the vaccine. Dr. Danielle Johnson joins us with how to discuss the vaccine, what to say to someone still on the fence about the vaccine, how to best educate others and send them after the right direction, just like both of our guests just mentioned. People who still need convincing about efficacy and safety, how to get them there. Get them there with that shot in their arm. Have a fantastic Friday and a great safe weekend. Meet us back here Monday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.